It's really rewarding to know that we've been able to partner with public health and have a positive impact on the community.
To help the community understand that the work that we're doing is really for everyone in our community.
To see the community and our organization come together, I think the impact has been tremendous.
James Ginsberg, I'm the Executive Director of Recovery Works, which is a new Colorado nonprofit. We opened up about 7 months ago the Respite Resource and Recovery Center. That's where part of where our name comes from, really the broadest sense of recovery from trauma, recovery from homelessness and various abuses and substances and mental illness. And so somebody can just walk in, get a laundry, shower, access to the internet, case management, a meal. We had vaccination clinic by public health. Each week now we resume the HIV and Hep C testing. Stride comes every day for our respite with nursing care, but then they also set up a walk-in clinic on Thursday. We have access to Jefferson Center for Mental Health anytime, 24/7 for their virtual therapy. Workforce comes in, so we're able to connect people with some employment and workforce opportunities. Average life expectancy for someone who's chronically homeless is 49 years old. And so it's kind of a third world existence. You know, I always like to start by saying the solution to homelessness is homes. By definition, it's homes and appropriate supportive services. And so as we're trying to move people from the street into housing, there's a lot of steps along the way, and that includes public health. And so we try to be a one-stop shop, and public health has been great in engaging folks in harm reduction, HIV and Hep C testing, really responsive to being on site. My dream is that we continue to see and understand homelessness as a public health problem, and that there's a public health solution. People aren't worried about the numbers right now. We're worried about building an effective infrastructure that's going to have long-term solutions, and I'm really encouraged by that.
My name is Jason Cardona. I'm the Director of Pharmacy at Lutheran Medical Center.
I'm Andrew Bjork. I'm the Director of Pharmacy at St. Anthony Hospital in Lakewood.
I partnered with Jefferson County Public Health in a couple different aspects. The first one was with the COVID vaccine.
The work that we did with the COVID vaccinations in partnership with Jeffco Public Health really started back in, I would say, it was November of 2020.
When we got the vaccine, it signaled hope.
Started out with healthcare providers in frontline and those folks being tiered out.
Through the partnership, we're able to identify a lot of our high-risk patients in our population. And after we vaccinated our essential workers in the healthcare, we opened it up to our high-risk patients in our community.
I think it's had a lot of impact in a positive way. I definitely know it saved lives.
Coming from a spot 2 years ago where we didn't have anything to be able to help treat, and within those 2 years, having safe and efficacious vaccines, as well as medications to help treat and prevent COVID-19 in our highest risk population has been impressive to see.
Having treatments and having vaccination status, knowing that people with those, that the odds of dying are much lower than early on in the pandemic, has definitely allowed us to start living life again.
The partnership that Lutheran Medical Center, SEL Health, and Jefferson County Public Health was really critical in being able to take care of our patients. And Jefferson County Public Health was advocating on behalf of Jefferson County to get allocation for scarce meds and vaccines at the time to get them into Jefferson County.
Well, I don't think it was just all my work. It could never happen without a team, right? I had such great support.
It really hit me hard when we started offering the vaccine. So many people were just thankful and grateful and crying, and to see that level of impact in our community, and to know that we've done everything we've could to help provide hope and treatment and a lot of things for our community to help them survive and thrive in the COVID-19 era.
Most folks in healthcare, they do it to take care of folks, right? And I think this is no different. We do it for a reason, and that's really to make people feel better and live longer, live healthier lives.
I'm Padma Polepeddi. I'm the Assistant Director of Public Services Community Outreach from Jefferson County Public Library.
Hey, I'm Tori Sandoval. I'm the Teen Outreach Librarian with Jefferson County Public Libraries.
I'm Erica Tona. I'm the Teen Services Coordinator for Jeffco Public Libraries.
I'm Nick Taylor. I'm the Public Services Manager for Edgewater, Wheat Ridge, and Teen Services at Jefferson County Public Library.
With the public library, we offer a wide variety of services to youth in our community. We really want to make sure that they feel valued when they're coming in the doors of our library and that they are important members of our community.
We are doing this awesome internship with Communities That Care. It is so cool. And my set of interns are really just creating awesome, incredible teen events for other teens. The most beautiful part of it is that these teens really get to practice in a safe space. How do you plan an event?
We have youth advisory boards in all of our libraries. So those are our teen advisory boards. They help us decide what programs we're going to offer, build those programs, help us understand what kind of collections we should be offering in the library. So just in general, helping inform us what we should be doing for youth in our community. So having that authentic youth voice in what's happening in the libraries.
It seemed a very natural collaboration to collaborate with public health because our outcomes and objectives are so aligned for the social, emotional well-being of our youth in the community.
We've been able to just align our strategies because so much of that public health, moving the needle for teens, where we say we want to lower stress for teens, we want to reduce risk factors for teens, that is so much in our same wheelhouse.
When we bring these community organizations together, we can really accomplish amazing things to help support youth in our community.
And I think oftentimes people don't necessarily think that youth are an underserved population within our community, but when you go and you hang out with youth, you realize, whoa, they needed this and they needed this bad.
For me, it's very innate and very personal to really help youth feel that they matter, and there are so many people outside of their own family who care and who are excited, not just care, we are excited about their growth.
For me personally, working with Communities That Care and seeing the impact that we can have on our community is just, it makes me feel proud to be part of Jefferson County.
We're really just helping each other grow while we're giving youth the opportunity to just be themselves and experience just new opportunities in this world. And it's a beautiful thing to see, and it's really awesome.
I'm Brittany Rietveld. I am the Jeffco Fairgrounds manager.
My name is Erin Smith, and I'm an event coordinator for Jeffco Fairgrounds.
We typically operate as an over 100-acre property, as an event venue and a large animal evacuation site during emergencies.
Jeffco Fairgrounds has partnered with Jeffco Public Health, along with many others the past few years, on providing and coordinating COVID-19 testing 6 days a week and vaccine clinics 3 times a week.
That was a big focus, was how do we offer hours that anyone can come, whether it's after work or during lunch or before work.
And luckily, the testing and vaccine clinics were accessible for all. They were free. It was pretty easy for anyone to come around for that.
We've had some really great partners like Jeffco Safety and Compliance who have come alongside us, and we've been in constant communication with them and public health just to make sure that it does go smoothly.
Even before the pandemic hit, the decision was made to where we can only host agriculture, equine, and youth events. And a big part of that was being able to accommodate large animal evacuations.
We were activated as a large animal evacuation site for the Marshall fires. And that was kind of an overwhelming moment for our team because we have events, we have COVID testing and the vaccination site going on, and then we're supposed to bring in all these animals. We were just able to reach out to everyone. Public health was very understanding that we had to either delay openings or close COVID testing or the vaccination clinics for the day. But it was just kind of another, this is the community coming together and all of our partners coming together to support us and support everyone that needs us.
So it definitely made us feel very valuable, and it made us feel very important doing all of that kind of work.
If an animal shows up and we are activated as a large animal evacuation site, that animal will be brought in and fed and cared for. And if they need it, they will receive veterinary services.
Personally, and honestly, I don't think it would have been possible without my team as a whole, and then all of the other departments and divisions that came together to help us with it as well.
It's very rewarding and great to know that we've had a positive impact throughout this on our community, but there's no way that we could have done this without the support of our leadership and our partners, and just the team's willingness to help has been great to see too.